Hi, I'm Nidhi Shetty and I'm 25 years old. I'm from Mumbai, that's in India, and I'm a nutritionist by profession, and I was previously employed with Nestle as a infant nutrition delegate, and currently I'm a homemaker because I recently got married. I was diagnosed with glaucoma in September 2010, and then it got worse very quickly. Post June, June 2011, I could see that I could see halos around lights, and I could not see clearly, and the headache was getting all the more worse. My vision had deteriorated to quite an extent in one of my eyes, so that's how I was introduced to a new set of medications, and I was prescribed a number of medications which kept changing because I couldn't tolerate some of them. And before I underwent a surgery, I was using 3 types of eye drops, which were 3 times a day. So it was almost like 9 times of putting eye drops in the entire day. And on top of that, I was taking Diamox tablets every 6 hours, and that was also having a lot of side effects in terms of experiencing numbness in my extremities and dizziness throughout the day. So that was the time I decided that it's enough of medications, and my doctor said now you cannot tolerate this anymore because it was still not arresting the pressure in any way, and so then I had to undergo surgery. In terms of lifestyle modifications, after being diagnosed with glaucoma and being recommended so many drops, it was really difficult getting on with normal life because putting 9 drops a day wasn't easy, first of all. I have also high myopia, so I was wearing contact lenses. And if I had to put these eye drops regularly, it wasn't possible for me to keep removing my lenses every time I had to put the drops and then wait for half an hour till I can again put back the lenses. Because that was kind of irritating, and when you're traveling especially, you need to have that sterile environment where you can keep removing and putting on the lenses again, and hygiene, and it's a big issue there. So I didn't want to take chances with infection because of this. And secondly, these eye drops, some of them cause kind of dryness in the eyes, and also they sting your eyes, make them red. You have blurry vision after using some of the eye drops, so it wasn't easy at all. After monitoring my intraocular pressure and seeing that the eye drops were not working, and even the tablets were not working for that matter, and my pressure was in the high 40s, which was crazy, absolutely crazy, and I could experience crazy headaches throughout the day, and it was blurry vision and really bad. And the doctor was really freaked out, my doctor in India, and he told me it's high time you undergo a surgery. I don't want you wasting even one more day because even the field of vision tests were not so good, and it showed significant loss of vision in the right eye. So he didn't want to take chances with the left eye going bad, and so he suggested something like a shunt or a valve to be placed in the eye, and then he said that your pressure is so high that maybe you will have to use 2 valves in the same eye to get down the pressure, otherwise it will not go down with just one shunt in each eye. So it has to be 2 valves in each eye, which was somewhat scary for me because at the age of 25 I didn't want to have these external bodies inside my eye, and with no guarantee whether it will work or not. And there are a lot of then he said you cannot use contact lenses, the risk of infection is very high, and then you have the other form of surgery wherein you have a bleb formation taking place, and then therein again you have a lot of lifestyle modifications because the bleb has high chances of infection taking place, and your eye might get worse even after getting the operation done. So I just googled new treatment for glaucoma, and coincidentally, I came across Dr. Richardson's website because I think he has a website with the same name, and that was my key search words in Google. So I came across his website, and so I got back to Dr. David Richardson with all my set of questions, and almost literally every day I was asking him around 5 to 10 questions, and he got back to me with the answer for each and every question I asked him. So that somehow boosted my confidence in this procedure, and my family was very supportive for that matter, and seeing the lifestyle modifications which I'll have to undergo if I go for the conventional surgery which I have in my home country, I just weighed the options, And then I thought nothing is more important than the vision, right? So I'm just 25 and I have a long way to go. I first got my right eye operated because the vision was really getting worse in that. And within 2 days after, the next day itself, the bandage was removed, and I took another 2 days to just recover from the whole thing. Then we had decided that we'll get the left eye operated after a month. But unfortunately, the pressure had shot up to 56, and seeing how good the healing was in the right eye, Dr. Richardson suggested that it's better to undergo the left eye surgery ASAP, because it would just end up making the vision worse if I waited for one more month, because 56 is a really high intraocular pressure. Once I'm back to India, I think there are a lot of doctors waiting for me to get back there. I'm like the guinea pig there right now for canaloplasty, because I had taken 5 or 6 opinions before I came down here from different doctors, because I couldn't believe this was happening to me, first of all. And so I just wanted to confirm that it is glaucoma, and there is no other option available in terms of surgery. Once I go back, I'm surely going to tell them how it has helped me, and the data will be there for them in front of their eyes to see. So I think that should convince them, and this should be good, I guess. At least I might not be able to make a change, but even if few people are aware of this because of me, it would be great.
So when you looked at all of the lifestyle modifications and the risks, especially for somebody young, myopic, that are involved with trabeculectomy, traveling all this way for canaloplasty really seemed a reasonable option to you.
Absolutely. It's been totally worth it, and I knew it would be difficult in terms of getting here financially, also in terms of getting a visa and then coming here, and staying, everything. There's a lot of cost involved when it comes to traveling all the way from India and then coming here. But seeing the plus points in terms of I told you that I'm a nutritionist, and I am also a certified yoga trainer. So there are a lot of physical activities which I will be involved in post this surgery. So will that be safe for me or not? And seeing that I don't have to undergo a lot of lifestyle modifications, it's hardly anything. I think it's totally worth it, and I don't regret the decision of coming here and getting the surgery done at all. I'm totally very happy with it.
Wow. Do you have anything that you would say to patients living here in America who are considering their surgical options for glaucoma?
I would tell them that you're really lucky. You have the doctors here who are able to do this, and there are doctors in India who want to do this, but probably they don't have the knowledge about it till now, or they have not been able to take out the time. I don't know what's the reason. But if you have the option here, I think you should totally consider doing it, because everybody is not so lucky. So I would totally recommend this.
Wow.